Hello, viewers. Thank you for joining us with Let's Talk About Jesus podcast with Viewpoints Ministries. We just finished a wonderful session with Let's Talk About Jesus online with Dr. Taye Oni. She talked to us about the medical practice and the age-long conspiracy theories. And today she's here again to give us some points, practical steps that we can take, that medical practitioners can take, practical steps that medical practitioners can take to improve the trust of people in medical practice. Thank you for joining us, Dr. Taye Oni. Can you take us away? What are some practical steps that medical practitioners can take to improve the trust of people in the medical practice?
Thank you so much, Miss Becky Emmanuel. And once again, I'm grateful for the opportunity to share. So improving trust in medical practice involves a multifaceted approach. So here are some strategies to foster trust. Like I said earlier, clear communication. There must be clear communication. There must be a good rapport between you and your patient. Healthcare providers should communicate effectively, listen actively, and explain diagnosis, treatments, and procedures in a clear, concise manner. Do not leave your patients in doubt. See them, put yourself in their shoe and communicate with them the situation. Just be honest with them that if they don't do this, if they don't do that, this and this will happen, that there is a need for them to take their medication, there is a need for them to do their annual physicals. You don't have to be sick before you go to a provider. Thank God for the opportunity that we have in developed countries. In some countries, there's no room for annual physical. But here, seize the opportunity. Go for your annual physical. It's called preventive treatment. You don't have to be sick before you see a provider. Do the prevention. Go for your wellness checkup, do your physical, do your blood work, check your breast, check your urine, and so on. There are some developmental stages tests that are related to age. For example, once you among the youths 21 and down, our focus is STDs. We want to counsel them, the risk of STDs and so on. Then once we are 21 and above, we start checking for the pap smear to check for cancer of the cervix. The younger ones, to tell them to check their testicles to make sure there is no cancer of the testicle and so on. So encourage them to do what they're supposed to do. Once they are 40 years, they start doing mammogram screening for cancer of the breast. Once they are 40 years, as male, they start checking for their prostate. It's called prostate specific antigen, the digital rectal examination. Then you also, once they are 45 and above, you start doing colonoscopy and so all the age-related tests. You want to encourage your patient to do. You want to tell them the risk that's associated with not doing it. You want to tell them about the proper vaccination. So transparency, be open and honest about medical error. If you made any error, let them know, oh, I'm sorry, I'm supposed to do this test, I did not carry it out. I made this mistake, I drew your blood in the wrong tube. When you come back, I will repeat it. Just let them know, be open. Give them also treatment options and let them know the outcome of their treatment. Then let there be patient-centered care. Prioritize patients' needs, values, and preferences. Listen to them. There's what is called cost-effective treatment. Don't treat your patient with what they cannot afford. If you give prescription, if you give them prescription for the medication they cannot afford, they will not take it. So look for one that they can afford that is also as effective. It's called cost-effective treatment. So just do everything possible to encourage your patient. Prioritize patient needs, values, and preferences. Then let there be good counseling. If you are smoking, these are the outcomes. You are endangering your lungs. If you are drinking, you are endangering your liver. If you are having, if you are especially promiscuous, you have risk of STD, use condom, do this and so, do safe sex. Then continuity of care, establish long-term relationship between patient and provider. One thing I also want to talk about, before people marry, let them know their gene. You know, when you are AS and your partner is AS, you don't want to marry because you have risk of having sickle cell patients. Also, let them know they need to know their blood group. There is something is called resource factor. You want to let them know the kind of husband they can marry, and if they are Rh negative, that they have to know on time so that they can be given injection that is called Rogam, so that they can be able to have children. Because if they are not taken care of, if they have that child without being given, if they are Rh negative and they have that pregnancy and they lose it, they might never be able to have children again. So all those education you need to give to your patient, their cultural competence, recognize and respect patient diverse backgrounds and values, respect them, share decision, let them be involved in the treatment that you are giving to them. Then accountability, hold providers accountable for the actions and outcomes. Then patient education, empower patients with knowledge about their health and treatments, teach them how to do finger stick, whatever they need to do at home, empower them to be able to do it. Teach them how to do their vital sign, support patients' autonomy, respect patient decision and choices, foster a positive healthcare environment, ensure a welcoming, safe and supportive environment. Let your environment be clean, let them come there with joy, with confidence that you accept them as your own. So by implementing these strategies, trust in medical practice can be improved, leading to better health outcomes and stronger patient-provider relationships. Thank you.
Thank you so much for those quick practical steps, Dr. Oni. Again, I'm your host, Becky Emmanuel, on today's Let's Talk About Jesus podcast with Viewpoints Ministries. I just want to talk about maybe 3 points that she said already, just to reemphasize it. Prioritize your patient's needs and preferences. Have clear communication with them. Be culturally sensitive, be accountable, and educate them. I just love those points, so I wanted to reiterate them. Thank you so much for talking with us, Dr. Oni. And this has been Let's Talk About Jesus podcast. Enjoy your Sunday, everybody. Thank you.
Thank you. God bless you.